Good morning, Dr. Moss. Welcome.
Good morning. Good morning, everyone. Nice to see you all again.
Good morning. Good morning.
So we'll get started here. I'd like to welcome everyone to our third webinar that we're doing with the Livermore Valley, Dublin, and Pleasanton Chambers of Commerce with Dr. Nicholas Moss from the Alameda County Public Health Department. He is our health officer. And I just want to greet everybody real quickly before we get rolling with him. And just take a moment for my counterparts in Dublin and Pleasanton, if you have a few words before we get going with Dr. Moss. Inca?
I get to go first. Hi, this is Inca Houston, President CEO of the Dublin Chamber of Commerce. Thank you for joining us today, and I look forward to some exciting news from Dr. Moss we're hoping for, or at least realistic news. Thank you.
Good morning, everybody. Steve Van Dorn, President and CEO of the Pleasanton Chamber. Thank you, Don, for putting this together. Thank you, Inga, for your partnership. You know, we all were working together to get through this pandemic, and we're so happy you're here, Dr. Moss, to hopefully give us some good news that we can look forward to over the holidays and beyond. So thank you for joining us.
Okay, thank you. And I just want to acknowledge our production partner today. Amos Productions is producing the webinar, and this is being recorded, and it's also being put on Facebook Live. So you'll have plenty of opportunities. If you can't stay for the entire time, you'll be able to access the recording later on our websites. But do be sure and put in any questions that you may have for Dr. Moss, and we'll get to them later. And you know, we'll be able to follow up with that if you aren't able to remain with us today. So with that, we'll get rolling with Dr. Moss. Welcome.
Thank you. Good to be back. Excuse me. Good to be back here with all of you, and looking forward to this conversation. You know, I am glad to hear a lot of optimism and excitement to have me back. I just want to, you know, say from the outset, there are no major changes on the horizon in the next few days. And I think that unless you're, with the exception of schools, which we can talk about, I know that's a little bit of a different area than we normally cover in this group. What I can do is give just a little background on what's going on with the county and the region, and really nationally. So there has been a surge of cases in the Midwest, pretty substantial in many places, really extending into the Mountain West. The West Coast continues to do relatively well. Oregon, Washington, and California together have seen increases in case rates over the last several weeks, but nothing like what's being seen in the Midwest. I attribute this to just a more conservative approach in terms of what areas are allowed to be open. And also, I think, and I haven't seen numbers on this yet, it's a little early, but we know this from earlier on in the pandemic, probably much higher rates of face covering and mask use. And you know, we're still in a relatively good position. Regionally, we're doing better than California as a whole. Case rates in the Bay Area are even lower for, I think, the same reasons that I've just shared. And in Alameda County, we've done very well. We've come quite a bit down. I don't know if what the last date of the last time I spoke with this group was. I'm not sure, Don, if you remember, but you know, we had quite a substantial summer surge. A lot of people in the hospital, many cases, many deaths, more so than we had seen even earlier on. And we came out of that. We had very low numbers in September, especially coming out of those periods of heavy smoke in the area. And we opened up quite a bit. We've opened up pretty much everything that's allowable in the red tier, we are in the orange tier from the state standpoint. We have opened very little in the orange tier, consistent with our approach to take it slow. And we are right now hoping to move on and open more things in the orange tier, but we're not going to do that imminently because of the rising case rates. And I think we really want to, even if things go up a little, that's okay. But if things are about to go back into the red tier, we really don't want to open a bunch of orange tier stuff to close it down again. And we don't want to be opening lots of things up in the setting of rising case rates, because we suspect that would fuel more of a serious surge than what we're seeing right now. So again, the message is slow and steady. The exception being middle and high schools. We allowed elementary schools to return to in-person education a month ago. And as of next week, middle and high schools will be allowed to return to in-person education. This doesn't mean that every school is ready to go. And we know many schools and school districts are going to take some time before they're bringing children back in any substantial numbers to in-class. But we do feel like with the case rates where they are, that's still okay. But again, because we're doing that, we're not going to jump with both feet into lots of other reopenings, given what we're seeing with the case numbers. So I think, we're glad to be where we are. We're glad that we've been able to open all the red tier stuff. We're not moving very quickly, but that's consistent with where we've been all along. And I think that will help us keep this uptick from becoming something more serious. And I'll note, I know this comes up a lot in this forum, Contra Costa County is actually having to move backwards. They've announced that this week. They're moving faster than even the state would allow, because I think we've all realized that the state really has to speak to jurisdictions that are very different from ours, and they're a little, they've allowed probably more than we think makes the most sense in each tier. And so you're going to see that reflected in policies throughout the Bay Area. So with that, I'm happy to answer specific questions about all of that stuff and anything else I can.
Well, we have our first question. It's very important. How's the baby?
Thank you for asking. I really appreciate it. He's doing great. He slept from about 10 p.m. to 6:30 a.m. Overnight. He'll be 10 weeks on, I think, Tuesday. So we're excited about that. He's been a pretty good sleeper, but I've been up for 45 minutes to an hour every night, going back to the beginning, some nights more, and my wife as well. And so it hasn't been as bad as we've heard from other parents, but we're glad to, even if it's just once in a while, have a full night of sleep. And he's upstairs, otherwise I would show him off to all of you.
Okay, so it looks like the last time that you were with us, Dr. Moss, was on August 14th.
Right in the, coming to the end, but still really at a time of much higher case rates than we have now, about 15 per 100,000 per day. Now we're at about 5. So, and our hospitals were not full, but we had in August at our peak over, I think it was 213 people in the hospital. Now we have about 65. So much improved from that time.
I guess I'll take the first question in the chat. This is from Jates. Employees who test positive not related to work are reported via their clinic they tested. What reporting requirements do we have as the employer?
Yeah, so and the state has actually just, I think, put this into law, but we were already requiring employers to notify us. It doesn't matter because it can be hard to know where people were infected. If your staff has, if there's a case, we'd like to know just so we can make sure that you have what you need to keep healthy. It's not considered an outbreak until there are certain more numbers and certain criteria are met. The state sets those criteria, but we still want to know just so we can really support businesses. and stay on top of that. And I urge everyone to familiarize themselves with. Gosh, if Eileen is on here, she can remind me the state. I think it's AB, or maybe somebody in the chamber knows. One of the chambers knows 365. I think the state assembly bill that passed regarding this topic, and I'll see if I can look that up on the call and just confirm. But so this has now kind of become a matter of state law, and so I encourage everyone to do that. If you don't know, you can't report, and we have a team available to report to. If you do know, that's our COVID workplace email, covidworkplace@acgov.org. And we really, really appreciate this. There's nothing, punitive about it or anything like that. It just helps us make sure that we're helping you keep your workplace and your customers safe.
Thank you.
Okay, I'll take the next one. The start of high school athletic season has been scheduled by the CIF to begin on December 7th. This includes sports of football, volleyball, cross country, and water polo. What are the prospects of these sports being allowed to proceed in Alameda County? Are there any?
Oh, sorry. Go on, Inga.
Are there any specific limitations or protocols being contemplated by the county so our student athletes can join their peers in 44 other states who have already begun their respective seasons?
Yeah. And I think CIF put this schedule out way back in July, and not. My understanding is not in close consultation with the California Department of Public Health. But nevertheless, this has been a topic of a lot of conversation at the state level. The state has guidelines that are in draft form. I have not read them, but they're out there. They're going through approvals. I do expect that they're going to allow some competition tied to county tier levels, right? So the lower you are in the state's framework, the more you can do. Outdoors is going to be earlier than indoors and things like that. But I don't know the specifics yet, and I don't know the exact time frame, and it'll kind of depend on where we are. I don't think also it'll be, tournaments, traveling teams, things like that. It's going to be more, one school, two schools competing against each other, but not, 14 teams for a weekend kind of thing. And so I hope that's helpful for people to put in mind. I know more substantial planning will probably have to wait until we have a little more guidance. I will tell you from my standpoint, I'm happy to go along with whatever the state allows, unless there's something regarding indoor activities where we think there's real risk. And I think that if you see what's published out there in the literature, indoor settings without masks, has been some transmission of COVID. Hockey is the best example of this. I know we're not a huge hockey area, but it's indoors, and without masks, people breathing heavily, you can get spread. Outdoors is definitely safer, and I think as we learn more, even contact sports to a certain extent will probably be okay. The pros have a lot of testing, but we know from even some of the experience in the pros that there's probably some relatively safe level of competition in outdoor settings, as long as our community levels of transmission aren't too high. So I'm very supportive of that. It just depends where the state sets the bars for things. And I think it's important for our kids too. So.
Okay. The next question, is there any coordination with state and/or CDC on vaccine distribution structure and how that would look like when we are ready? Does the government have any idea on our realistic timeline, when and if available?
Okay, so I'll tell you what I know, and I'm not, I participate in all our local discussions and also with discussions with the county health officers and at the state, but I'm not running this for the county because we have some folks who are in charge of vaccines, and happy to come back with more specifics if you need them. So there's a lot of planning going on, and the state is really very active in trying to make sure that they don't just take what CDC and what the federal government gives us, but rather, look at each vaccine candidate, make sure that they're doing the, what's best for Californians. They've appointed a statewide vaccine safety and efficacy commission that includes the health officer from San Francisco, a professor at UC Berkeley, and another county resident who's used to lead the U.S.'s international HIV effort. So very, people who understand how to read the clinical trial data and who understand, I think, some of the unique concerns and just structural issues with the Bay Area. And so, I think we're going to get pretty good vetting of those vaccine products when they come out. The companies are saying that they will present, at least I think Pfizer's the first furthest along, and they're expected to present data to the FDA sometime after Thanksgiving is my understanding. I'm not sure how far after Thanksgiving that is. So we'll know a little bit more about how realistic things those candidates are. And then the CDC, it's called the ACIP. I think it's, I can't remember exactly what it stands for, but it's the committee at CDC that makes vaccination recommendations. So they'll make some recommendations based on that data. And then the idea is that vaccine could be distributed as soon as the end of this year. I think that's pretty bullish. I would be surprised, but there may be some doses distributed at the end of this year. The Pfizer vaccine requires minus 70 degree Fahrenheit cold storage for anything more than I think five or 6 days. And so, that's a little complicated for those of you who know anything about cold chain. That's a big part of, safe vaccine distribution, and we don't want to waste any of this vaccine. There's those kinds of things need to be taken into account when we think about how much vaccine we have, where it can be stored, where it can be prepared for delivery. And then the other thing is prioritizing groups. This is going to be really contentious and complicated. There's a lot of national and state prioritization schemes coming out. It's probably going to involve some mix of healthcare workers and at-risk adults in the very first waves, and then other essential workers, first responders, soon thereafter. But it's really going to depend on how much amount we get. And so what we are doing, and a lot of the vaccine distribution, I know this is part of the question, is going to go the federal government to the state, or actually the manufacturers, I think, directly to the state, and then from the state to healthcare providers. And so we, the county, are not necessarily going to be holding a lot of vaccine supply and distributing it for the most part, but we will probably do some of that. And we're practicing with flu vaccine now, just to make sure that we, with COVID and physical distancing, we know how to do any vaccine distribution that we need to do, and that any key partners that we are going to work with are in the same boat. But most of this is probably going to go through the large healthcare systems and providers. That's the way it's shaping up right now. When we know more, I'm happy to come back to this group or have Dr. Kathleen Clannon, who's a medical director for our healthcare services agency and leading our vaccine work, come in and speak again about the details.
We have a question in the chat and the Q&A that's kind of similar, so I'll try to pull them together. One of them is, what are your recommendations for when service clubs, organizations, or any group could transition to meeting in person? Which I know you kind of mentioned that already. And then kind of related to that is, can you comment on, for outdoor events like weddings or fundraisers, what is our current limit on number of guests? So those are event related, one inside, one outside. So there are specific areas in which we've sort of made clear what can be done with gatherings, right? And so there's some sectors where types of gatherings are allowed.
And then for kind of private gatherings, it's really framed, and it's been in anticipation of the holidays, it's really framed around households. And I will tell you that it's 3 households, which isn't that easy for these kinds of other types of gatherings that you're talking about. And 20 people is what we've said locally for Alameda County. And so really only under sort of very pretty strict conditions are we saying, non-essential work-related gatherings are acceptable. This will change over time if our rates stabilize or hopefully go down further at some point. But that's where we are now. I think if it's essential work-related, you can have in-person meetings, but I highly recommend against them if there's any way that you can do it remote. I know it's not ideal, but we're just not quite there yet. Gatherings together are about the riskiest activity, and especially if masks come off. If they are happening, outdoors is safer, 6-foot distance, face coverings, no food, please. But I expect that we will, when we get back on track with, reopenings, as the case rates stabilize, we'll relax some aspects of this. But I really encourage remote meeting as much as possible. It's where we're going to be living for at least into, well into 2021.
Just to clarify the question about outdoor events, is it still?
Oh yeah.
Is it still 12? Is that the number, or is that changed, or is there any? It's not 12. I think that number was. I think that's tied to fitness activities specifically, and I believe it's now 20. But I believe that's specific to our fitness guidelines. And then, as I said, our sort of general private gathering guidelines are also limited at 20. Then there's some specific numbers associated with like religious worship and cultural celebrations, which includes weddings. And I would have to pull up our order to see exactly what those are, but you can find the current numbers on our website. I just don't want to give people the wrong information off the top of my head. Yeah, Rosie said it's 20. So. Okay.
Yeah, and if Eileen Ng is on, she might be able to pull up and either post in the chat box what's allowable for cultural celebrations. I know that's of interest, but and I would remind folks those are wedding receptions are not currently allowed by the state. So when we talk about weddings, we're really talking about the ceremony.
Thank you.
Okay. And we have an organization that runs a charitable bingo game. What category should they look under for opening guidelines and timelines?
It's a good question. I'm going to have to get back to you on that. I think sometimes the state has specific regulations about things like this, and I'm not sure that there's anything for bingo. If there's a question, there probably isn't, because I imagine that person would know. And so then what we have to do is try to sort of figure out what sector bingo looks closest to. If it's outside, that's going to be a lot more flexible. Inside may be restricted for the time being. We're really not allowing a lot of indoor things, although we are allowing some. So we do try to be consistent and allow things where we can.
Okay, yeah, there's some similarities with the family entertainment centers.
Mm-hmm. Sure.
So, but I think it's important, and we appreciate the fact that your department's been open to considering those, where there's similarities or common operations.
Yeah.
To at least look at that and consider it and say, yeah, that looks like under that category that could work for us. So having people raise these is important.
I think family entertainment sounds about right for bingo, and it's just a question of us making sure that we have all our T's dotted and I's crossed, so to speak.
Right. And right now I'm looking at the latest November 3rd openings at a glance that you have posted. and that is family entertainment centers are 25% capacity for naturally distanced activities like bowling and climbing walls.
It just depends on if the state sees it as gambling or family entertainment.
Yeah, I mean, I think that if the state is silent on it, then we have a lot of flexibility to sort of interpret, what makes the most sense to us. So.
I know the fairgrounds just posted a bingo, something going on with bingo, so they may want to connect with them and see how they're implementing it.
Yeah. And we'll, I think I have something in my inbox about this. My apologies if it's the same person and we just haven't got back to you yet, but we're doing our best to keep up with some of these various sectors that, haven't been fully captured in the, guidance to date.
Mm-hmm. Mm-hmm.
We have a question. It's lengthy. Do you want me I can just get down to
Go ahead.
the nut and bolts of it, but it's a restaurant owner who is providing jobs and trying to provide a safe environment for customers in the community. They provide jobs and salaries to the members of our valley and are needed to pay the bills and mortgage and food. And it's a tough task these last 7 months and they're still at risk for losing their business. The upcoming colder weeks are forthcoming, and now that people are going to probably want to eat indoors as opposed to being outdoors and risking a cold.
Yeah.
We are allowed to open at 25%, and the state says, we're at the 50%. What are the parameters are you looking to eventually move the restaurants to 50% capacity? And then the last bit is I am asking these questions as I'm trying to plan for business for the next few weeks.
Yeah, I mean, restaurants is, I have to be honest, one of the most difficult areas because just by nature of the activity, people have masks off. We know that it's a place where transmissions happen, particularly indoors, and it is. I can't promise things that I can't deliver on, and so. As we've got indoor restaurants open at 25%. If things take a turn for, as I said, case rates are up, but if they really take a turn for the worse, that's going to be among the areas that we look at for moving backwards. Just because we know it's a setting where lots of transmission can happen. So it's very difficult, and I understand restaurants have been hit extremely hard by this pandemic. That said, I want to preserve indoor dining as long as possible, and I want to preserve outdoor dining as long as possible. And if we have to step backward on indoor dining, I want to work with the industry, but also with the state, and make sure that if there's things we can do to make outdoor dining a little easier during the winter months. I would rather go softer on the regulations on outdoor dining, so that people can operate in a way that their customers are comfortable, rather than, if I have to, let me put it like that. I want to try to support the industry as best as possible if we go that way. Now, the flip side is I can't provide a timeline, but if things stabilize, we stay in this orange tier level, which I have to be perfectly frank, I don't think is going to happen. But if we stay in the orange tier, we will eventually move to 50% capacity. It's my goal to, over time, get in alignment with the state if things are stable. The problem is, I think we're going to have to weather some hard weeks here with what's going on nationally and across the region and the state. And I think we are similarly, the holidays, it's a little unclear whether we'll see some, people are going to gather, they're going to have meals together. It's a little unclear whether that'll also contribute, accelerate this rise in cases.
Inga, do you want to follow up with that other comment?
This restaurant owner followed up with, is it riskier to catch a cold outdoor or indoor, considering the cold temperatures?
I think that indoors is riskier right now. COVID COVID is no joke, and we're seeing most cases now among sort of working age adults who might also be people going to restaurants, and some of them get pretty severely ill, or they get ill and debilitated for months. And I know the numbers look small, but we're talking about hundreds of thousands of Americans dead, and I think the risk is higher for indoor right now. But it's not so high that we don't feel like we can allow it at 25%. And as I said, if things stabilize, I do feel like the industry is doing what it can to keep people safe, and we'll push to 50%. It just happens to be, face coverings really work, and you can't wear them while you're eating. It makes it very difficult.
Great. There are no more questions in the Q&A, but I have one for you. This was sort of answered this week on another call, but I thought I'd ask you just in case it's different. I know it's difficult to predict the future, but any idea when non-essential businesses will be allowed to open up their offices for their employees and conduct business as usual?
So I just want one more thought about the last thing. I want to acknowledge that just because I say I don't think the health risk from a cold from eating outside is worse than the risk of COVID from eating indoors, doesn't mean that customers feel comfortable eating outside in January. So I totally acknowledge that, and I don't mean to imply that my judgment brings people through the doors. But so I wanted to recognize that. We really have not prioritized bringing non-essential office workers back. There's a couple reasons for that. First of all, a lot of businesses in Alameda County fall in the definition of essential, which means people are able to come back. Nonetheless, many of them have found ways to remote as much as possible, including, believe it or not, the public health department, where we're all like remote working, and you never would have thought a government entity, particularly ours, would be able to make that adaptation, but many are. That's good. I know there are knock-on economic effects from having office buildings closed in terms of rent, and also local restaurants that serve communities where office workers are. I totally get that, and so we will get them open. But I have to be honest, people have not been breathing down our necks as much for this as they have for other areas, and it just is, an indoor setting that people don't have to be in, congregating if it's not necessary. We really wanted to open up some of these other sectors first, and restaurants are a great example. So, we'd rather focus on those kinds of businesses before office buildings. But I think it's similar to the last answer. If we stabilize in the orange tier, that's one of the things that we would look at. We would ask people to wear the face coverings indoors, even if you're in a cubicle. And break rooms are a real danger zone for COVID because it's basically indoor dining, but it's unregulated. There's no restaurant staff there to kind of, even a lot of companies. I mean, there might be a sign posted on the wall saying, 2 people at once, but it's not really a regulated environment. And so break rooms turn out to be a place where a lot of COVID gets spread. And so when we do get to that place, we'll at minimum have a lot of recommendations around that.
Another question, are you working with the county, you are the county, for a path to reopen small meetings given the 25% occupancy allowed in restaurants? And this comes from our destination marketing organization, our Visit Tri-Valley.
Is this like conference meetings, hotel conference kind of stuff? That's a good question. I mean, we haven't revisited that, and I don't know what the state says for orange tier. I certainly would, again, we want to minimize indoor gatherings that don't really need to happen. And then the other thing about conferences particularly is there's travel, and that's a thing that we've always tried to, it's like the traveling sports teams thing. We really want to minimize groups coming from Southern California to meet with groups here and go back and forth. So that's part of the at least the hotel conference room planning. But COVID policy. But no, I think along the lines with indoor offices, it's an area where, particularly if people don't have their masks, who are able to keep their masks on, and the numbers are low, consistent with what we're allowing in other settings, I think we'll get to that place. It has not been a priority for reopening, I admit. And that's one I will take a note on.
Put on your radar.
Yeah.
Very good. Yeah, this is when this is good to get these things on your radar. For
Eileen Ng, who's our policy director for healthcare services, and it leads our COVID recovery, which is our sort of economic recovery team. She tracks all these things, and she sent me a list of things that had come up, particularly from Tri-Valley, in anticipation of this, and that wasn't on there. So I'll make sure it gets added to her list.
Okay. So it's on the list, Tracy. I see she's got more comments. So she appreciates that. Thank you. So I have a few questions here on the restaurants. I appreciate your comment about trying to support that business, until they can go, to 50% or more for the outdoor. But it does require some coordination with some other departments and agencies. So we're hoping that those discussions are going on. I don't know if there's regular meetings with environmental health.
Yeah.
Or even with ABC if necessary.
We don't talk to ABC regularly. We talk to our environmental health all the time. We're close colleagues, and they've been very involved in all of our restaurant planning. And then also we talk to the city managers fairly routinely, and this is an issue that comes up with them because they really want to get everybody opened up. Some of their staff might even be on this call. And we talk to our own fire department, Alco Fire, and then I know there are issues with fire and permitting and things like that. So those conversations do happen.
Okay, good to know. Everybody on this call today, and then you made a reference to this. Earlier on your earlier visits, we had the chart, the graphic with the phases, right? Mm-hmm. Now you're saying it's slow and steady, so we don't have our little chart to refer to anymore. And in the past, on the next phase of reopening, we are pretty educated now on indicators and what it is that guides your decisions. And you made a comment at an earlier webinar about the next phase will be within days and weeks, not weeks and months.
Yeah.
It's very promising. So what is your sense?
This time?
Yes.
I think that with our case rates kind of creeping up, I don't want to put any timeline on reopening. I will tell you this: last surge, that was about 6 weeks of real high level concern, where we were, I think we were paused for longer, more like 8 weeks, end of June to end of August. And what I will say is I suspect when we surge again, it'll probably be a similar kind of time frame that we're looking at high rates before things start to get under control. I think, or it could be even better. I think people know a little bit more about how to take care of themselves. And again, it'll kind of depend on how much of a winter effect and holiday effect we have on our numbers. But I think if we do surge, it'll happen relatively soon, like a real surge, like a day over day increases in cases. We're not there yet, but we're flirting with it. And then I would think it'll be, probably 6 to 8 weeks of really difficult trying to get those numbers back down under control, and then hopefully back to a period of quiet, and then who knows what the future holds. So I don't want to say that's the worst case scenario, because I don't like predicting the future with COVID. I'm always wrong. But I do think that is, it could be what we're talking about is, maybe from now, maybe 8 weeks of very conservative approach in terms of what's allowed, and then some more relaxation. I'd love to be proved wrong. I think there's a possibility that things will be more muted here. It'll be shorter, it'll be less dramatic, and we'll be able to resume our reopenings sooner. We haven't even really stopped them yet. We're just kind of stretching out the time frame. But I don't want to put any, it's not days, I'll tell you that.
Okay.
Not days. Could be weeks, hopefully not months.
So for the businesses that are watching today and that will watch this recording later, to prepare, because that's very key for businesses. How do we prepare? How do we plan?
I think we're at a delicate time, and I actually think hopefully we'll have a better sense of what things look like in a week or two. I don't, epidemics are dynamic. They don't, we're not going to creep up. We're not going to move at a creep indefinitely. We're either going to go up or we're going to stabilize. And I expect that we'll probably have a better sense of that over the next couple weeks. And then we can start forecasting maybe a little bit better. But I don't feel confident in really forecasting more. Right now things are moving too much. I'll leave it at that. And I would remind everybody that given all this, we're still planning to move ahead with middle and high schools next week. And so that's in recognition that, that's a pretty important sector. Hopefully there'll be some, that'll make some other economic things a little easier, at least for families whose kids are spending a little bit more time in school. That's probably going to that's not going to happen overnight, but I think to the extent that we are moving ahead with something, we're just focusing on that for the next couple weeks.
Okay. And by the way, folks, put your questions in there. The CEOs have plenty of questions, but we're also here to hear from you. So, Inga.
So, Dr. Moss, if I'm to kind of read between the lines, because I think it's in light of Halloween, going into Thanksgiving, Christmas, the gatherings, combined with the weather, combined with what we're seeing is happening in the Midwest in particular, it's up to us and our business owners to encourage the public to continue to wash their hands and wear their masks and enforce that. And that's what I kind of think you're saying.
Yeah, absolutely. I thank you for highlighting it. I mean, the more we do those things, I cannot stress the importance of face coverings. It's the more we learn about this, the more it seems that has really made an impact. I know it doesn't work for everybody for a variety of reasons, but the face coverings are really helping. And the more we use those tools at the individual level, the more stuff we can open across the board in the county. I mean, and I think we're going to find in the long run that it's going to pay economic dividends relative to places, even in California, that have elected to take a different, somewhat different strategy. So hand washing, face coverings, if you are open, use those rules, keep your customers separate. All that stuff is really helping. We know it's helping, and it will continue to help. And we haven't even seen the impact of certainly Halloween, the election, and the holidays yet to come yet. It's too soon. So, keep that stuff up as much as possible to try to blunt the impact of those holidays. And also, I'll say this Midwestern surge, remember, they're ahead of us in weather too, right? Cold weather hits the Midwest a lot earlier than it does these parts. So,
yeah, I was talking to someone from Wisconsin yesterday, and they've already had like 10 inches of snow in northern Wisconsin. And it's very cool this year. Forces
people indoors, So,
So if I could just add on to that, you mentioned it briefly earlier about gatherings of 3 households. We're coming up to Thanksgiving. People aren't sure what to do. how to handle it. What are your recommendations? I think everyone would enjoy hearing that from you.
Yeah, our recommendations are coming out Monday. I think Monday or early next week. It's joint with the other Bay Area counties, and it'll focus on really again limiting the number of families to three households, and less is more in this case. So ideally, you're just celebrating with your own household. Really doing things outdoors. And if you're going to do, Thanksgiving and Christmas, do it with the same people. And if you're going to do Thanksgiving, don't do Thanksgiving with, your parents and your sister's family, and then go to another Thanksgiving with your friends down the block. And it's like a whole separate group. This is not the year for that. So it's going to be those kinds of things. And we're also going to recommend for people who travel out of state, particularly those who are in settings where, because it's a different place, they're not wearing masks, they're in close contact with other people. You really need to ideally put yourself in quarantine when you come back. It's not going to be mandatory, but we're really going to strongly recommend that people stay home after a out-of-state travel, particularly if it's in a riskier setting. And so those are the kinds of things that you'll see. It should be out early next week. People are working on it this week and today.
So if you travel for Thanksgiving, stay home, but don't forget to shop local.
Shop. Well, I'm not going to make any comments on where people should shop. Yeah, it's going to be a different year for everybody, and I think it's hard, but really we're going to have to do our best, make those sacrifices, let's get through. There will be opportunities to gather in 2021. I feel very confident that things are going to look different. We're almost at a year of this. It's not going to last forever.
Dawn, did you want to take the next question? Or
Sure. There's let's see. Can we expect to see an update to the county health order early next week, presumably in concert with other Bay Area counties?
We're not intending any health order updates next week. I think we already updated our Appendix C to reflect middle and high schools. But there's no other updates planned. I'm not sure what other counties are planning for next week. I know Contra Costa this week was already making changes, but they're going the other direction. Mm-hmm. So they'll be more in alignment with us.
Mm-hmm. Yeah, they rolled back some of their openings. They just announced that, yesterday or Wednesday, I think.
And that, that's good for us, not just because it's less confusing for customers, but their case rates were a little higher than ours, but really there's not a huge difference between our epidemics. And if they get things a little bit more under control, that's good for our communities because there's a lot of mixing there. So, it was a tough call. Chris Farnatano over there is my counterpart, and all the same challenges, very difficult decisions, but I think that decision will be good for us regionally.
Yeah, I think the concerns when things are going on in adjacent counties. I mean, there's just no avoiding. I mean, they're like right across the street from us, so just conscious of that, I think. Okay. No more questions in there for the other CEOs then?
There's a couple popped up in the chat about my favorite industry, the wine industry. And one of the questions is, why can't wineries be categorized the same as restaurants with indoor activities of 25%?
It's a fair question. I think they were separated by the state, and so we've kind of handled them separately, and they were not prioritized. I don't think that was allowed in the restaurants at 25% is a red tier, and wineries indoors at 25% is an orange tier. It's one of those things that if things stabilize, we're going to look at. But I think if I were to point to any one thing, it's just that bars were really seen as a driver across the state and nationally during the summer. And I know wineries aren't bars, and I know that they can be regulated differently by the businesses themselves, but I think they kind of got a little bit lumped in there. I don't know. I've heard it speculated that the governor didn't want to appear to be doing any favors to the wine industry because it's his own industry, but I have no idea if that's really true. We, like these other areas, if we can get to that place, I certainly am supportive of it, but it's really a delicate time.
Well, as long as that's on the list to be looked at, I think our wineries would be very happy to hear that. So
yeah, we know there's a lot of interest. We know it's an important business locally. If anything, I feel like restaurants there was a good argument that restaurants could have been open later in terms of the state's approach rather than, the way they set it up. So.
Thank you.
For the sake of clarification, can you repeat the email that employers are required to report to?
I can, and let me even see if I can post in the chat box the link to the page. Where is it?
So while you're doing that, I'll ask the Thanksgiving hostess question. So do you recommend to sit down or everybody to have their own boxes, no buffet? It's a minefield at home.
I think we try to avoid, we want some flexibility out there, right? And we trust that people are going to be able to kind of take our guidance and make things work the best they can in their setting. The less people mix, the less people have to get up and stand next to each other. Maybe, the idea of a bunch of different people touching the serving spoons is of concern. Frankly, that's less of a concern to me than just having people gathering over the buffet table together in each other's face. And, I forgot to put my mask on because I was just eating and I'm getting up for seconds. So I think just kind of thinking in terms of, if you are going to do it, keeping people in a place where they can stay as distant as possible is the way to go. But, we avoided too much. We're so restrictive as it is. We want to allow some flexibility and have people just work with the general idea of keeping people distant, keep them outside. If you're going to do a buffet, do it outside if you can at all. And, and just kind of use your best judgment.
Give everybody a TV tray in their corners.
That's right. So let's see. So I posted the website, and then let me just make sure that I have the email address here. COVID infection reporting is the link on this website, and there is there's actually a form on this website under the tab that says COVID infection reporting, and you go to that, click on the link to the form, just fill out the form. You don't even need to do the email anymore. But there's an email address that you can email questions to if you have them.
Okay, so we have a question here, and they arrived a little late, but I don't think you can repeat this on the color tiers. So we are in the orange tier, but some of the activities are still in the red tier. Mm-hmm. And the question is, and what does that mean to wineries and tasting rooms?
Yeah. Yeah, so from the beginning, from the get-go, the state sets the floor, but individual counties can be more restrictive. And the state has to set a floor that speaks to the whole state, including counties that have very few people living in them. They're not very dense. They, they have different economies and different politics, frankly. And so from the beginning, Alameda County has moved more slowly. And I think that the reward for that has been better control of the pandemic locally. We're generally similar to Santa Clara and San Francisco in that regard. San Mateo and Contra Costa have generally moved more in step with the state. Although, as you've heard, Contra Costa is moving a touch more conservatively right now. And that's just been our policy. That said, when we hit orange, we really did try to get everything open in the red tier. So we're kind of a tier behind, and even some orange stuff with an eye towards getting to those other orange tier activities, such as wineries, 25% indoor, if we stayed stable. We just haven't stayed stable. We've seen some increases, and so we're really watching that carefully right now before we proceed to more orange tier things. And I do have to be honest, I don't know. If I knew, I would tell you, but I think that we will end up in the red tier probably in the next couple weeks, give or take. And then any of those orange tier activities, then it's out of my hands. They have to close by the state order. So I think that's the other aspect to this, is that, it's not clear that we're stably in the orange for long.
Mm-hmm. Well, hopefully you'll be proven wrong.
I would love to be proven wrong, and I've been wrong before.
Our businesses have been working very hard to ensure that not only their employees, but their clientele and their customers follow the protocols. And because there's just so much at risk for them. And so I'm seeing actively the businesses are, big signs. If you don't have your face covering on, then don't come in, and it's what we have to do. So I just what I've seen and observed, I think they've really stepped up on that.
And I think we've seen the impact of that, which is relatively lower numbers. We were one of the first counties in the state, certainly one of the first densely populated counties in the state to move into the orange tier because of those kinds of interventions. And I think that if you look at it, the drop in cases from the summer and the drop in deaths, we got down to very small numbers of deaths. Now cases are up. I do expect we're going to see deaths associated with those cases. I hope not. But that's because of the work of businesses and customers and residents to make this work. So
we have a clarification on the indoor dining. If we go back to red, are you going to go back to purple for indoor dining, or are you going to continue with the red level indoor dining?
It's going to depend on how quickly we're moving. If it's a gradual creep up and we're in the red but barely and everything else looks good, we feel okay about it, we're not automatically going to do anything. But if it's shooting up, we're getting more and more cases reported every day. Hospitals are getting more and more full. One of the first areas that we will look at, well, let me take it back. What we're going to look at first, if we feel like we need to reclose stuff, is indoor activities where masks come off. Dining is one of those. There are others. As I said, I would hope to do that in a way where maybe at the same time we can make outdoor dining as easy as possible, given the regulatory and weather restrictions and all that. That I would want to try to do that, but ultimately, yeah, I think indoor activities with masks would be the first thing that we would look at if we had to close anything. I hope we don't get to that place, and if things stabilize quickly, that's also, we would again, try to get things back open again. So,
Do you have a recommended best practice? I mean, as soon as somebody is done eating, should they put their mask on again, or should they wear their mask between?
It's in the order, actually. If you look at the rules for indoor dining, it's very specific about when people can have their mask off and when it should be on. And really, they should only have it off for eating. You know, it's better for the staff, frankly. If people are waiting around for their order to come, it's okay to have them keep their mask on. And you know, if they give you a hard time, you can tell them it's the health officer's order. One of these days, I'm going to get a badge, and I'll just come in there, and I'm just unlikely. But it really, I know it's tough because people, they're sitting down at dinner. Please do your best. They really only should have the masks off when they're eating. I wanted to say one other thing about all this. You know, when we closed things down in March, things were closed for months. If we have to close indoor dining again or other activities where people have a mask off indoors, it's only going to be until the numbers stabilize again. It's not 6 more months of this. Now, I know that people have already lost a lot of money. Businesses have already gone out of business. I'm not pretending that this is easy, but I don't anticipate it's going to be 6 months of closure. I would hope it's a few weeks and then we would stabilize again.
I guess I'll ask the next question that is posed. Do schools have the option to stop hybrid learning if there is a case at their school, or is it up to the health department to determine this?
Schools control, what the health department does is say when it's safe for schools to operate in person sort of across the board, and we provide guidance for that. But individual schools can be more conservative. They certainly don't have to come back and operate under any circumstances, and they don't have to shut down. Let's see if I understood the question correctly. So if there is a case in a school, the general approach is to, same as we would do in other settings, send anybody who's exposed home. But the rest of the school, if the school was okay with it, could continue to operate. We'd really focus on the exposed people. Now, the state has provided guidance. This is not, my understanding is it's not binding, that if, say, 5% of the students in a school had COVID because of an outbreak, that you would then consider closing the school. And so we'll likely follow state guidance if and when that happens. We know from across the state, there's actually been very few clusters in schools identified so far. There will be more as more schools open, but some counties open schools ahead of us, and it does seem that it's not an overwhelming number. And so hopefully it'll be schools or kids, some staff, classrooms that get closed for a few weeks, but not classrooms, I should say, classes or cohorts of students that have to go home for a couple weeks, but not the whole school. The health department is set up to help schools navigate those situations.
Who wants to take the next question? Me? Okay, what about live entertainment at restaurants and wineries in an outdoor setting? Is that allowed now?
This is a very active area of interest, and another area that the state has been very strict, actually, about not allowing any live entertainment in restaurants. We asked, for example, about DJs because, there's nobody's. You can wear a mask, And so I think this is an area that's in flux. I'll tell you, we don't want to get backed into a situation where it's a restaurant because they offer a burger, but really it's a nightclub. But that aside, I'm in favor of safe indoor entertainment for restaurants when we can do it from the state standpoint. And that'll probably mean performers that can be masked or similar. But we're not quite there yet. It's kind of a work in progress. And then outdoor live performances, similarly, the state is slowly working on their guidance for that. And I know San Francisco's experimented with some things, and it's a bit of a work in progress there. We're looking at them as well. I think there's going to be ways to do it safely, so we're just trying to get to that place.
I've been to some where they have the soundless.
Right, silent disco.
Silent disco, yeah.
So the entertainer speaks into a microphone and they don't.
Yeah, I mean, I think there are creative ways to do it, but there's also safe ways to do it, certainly outdoors, I think, with distance and things like that. So we're going to see some more of that, hopefully in the not too distant future. The state, I mean, we're slow, partly because I'm slow and busy, but the state is just a slow-moving apparatus, and it's got to get cleared all the way up to, the governor himself, as far as I can tell. So
we have a kind of a good, I don't know if it's a closing question, but it certainly kind of caps the whole conversation. What have we learned about the spread and treatments of coronavirus over the last couple of months? What has really percolated at the top that you share with us?
Oh, well, we've learned so much. We're learning more all the time. We're learning more about individual, sectors. For example, I've been reading everything I can about the science of COVID in schools and school reopening. I think we've learned that these things actually work, right? So if you want to get it, you want to flatten the curve, you want to protect your hospitals, you want to keep people from dying from COVID, face masks, social distancing, these restrictions, they do actually work, and places that have employed them have done the best. We've also learned that people get tired of them, and when they get tired of them, you start to see increases in your numbers. That's what the story is in Europe right now, which had done a great job. Why can't we be more like Europe? Well, they got problems too. And, people get tired of wearing masks, and they get tired of staying home or whatever, and you get rises in rates. So we've learned a lot about that. The research has really supported these measures, but it's also shown that people, it's hard for people, of course. We've learned a lot about how it's transmitted, right? So, can you get it from a doorknob? Yes, I would say that's possible. Is that the reason that most people are getting it? No, it's really this airborne stuff, droplets and aerosols. This debate about droplets versus aerosols that plays out in the press is great, but really what we pay attention to is where we see transmissions happening. And that hasn't changed. We see it in households. We see it in indoor settings where people don't have masks. We see it when people are crowded together and when there's more time together. And there just has been more and more data supporting those kinds of initial observations that we've had. We've learned how to treat people better. So people who look at this are seeing that the healthcare, the health outcomes of people who are sick with COVID appear to be improving. It's a little bit of also a work in progress from a research standpoint, but it may be that hospitals are just doing a little bit better caring for people when they are sick, and so hopefully preventing some deaths. But we're also learning that people really are having lots of problems from COVID for months if they do get sick from it, and that it kind of lingers, and so that's not necessarily a good thing that we've learned, but it is something that has been now borne out in a lot of studies. We're learning a lot about the effects of the pandemic on people's mental health, even if they're not directly affected by COVID. So this stuff is coming out all the time. Every day I get a list of new research articles and newspaper articles that are kind of researchy or other kind of public health reports. And I try to read every single one of those just so I can stay on top. But it's a lot. I mean, things are coming out every day. And some of those are leaps, leaps and bounds. This treatment really works. This treatment really doesn't. I would say on the whole, we're learning what of our measures are the most effective and what are less effective. Big debate about testing right now. I think we're learning a lot about the limitations of our tests and when they can be really useful and when they're less useful. I, for one, am not a huge proponent of testing lots of people who don't have symptoms or exposures. We do it because people feel more comfortable having access to it, and we want to make sure testing is available for people who really need it, people who are exposed or people who are sick. And sometimes it's hard to tell the difference, but we're really learning that, these tests are not perfect and they don't work great if people are not sick and not exposed. So, that's something we've been learning a lot about in the recent weeks. That's not to say you shouldn't get tested. If you think you need to get tested because you were exposed or you're sick, please get tested. There are excellent tests out there for that situation.
Thank you. Anything about the antibody discussion about whether that's happening and that's helping, or I don't know if you mentioned that, but I missed it maybe.
So a lot of antibody testing happens. It's not really useful for clinical diagnosis, except when you're really confused about what's going on. But it's great for understanding the impact of COVID on a region or population, how many people may have been infected. So I just met with some folks from the state of California. They're doing an antibody study around the state, and I think they're going to probably be in Alameda County. It's voluntary, and they'll look for antibodies. And it'll be really useful to get a sense of like people who may not have been tested, how much COVID was out there that we were missing. And we already have the results of some of those studies. You can look. CDC posts that on their website. Kind of got to dig for it, but it's there. So it's great. We also know that people's antibodies, the amount of antibodies seem to depend on how sick they were, and some people who are sick, their antibodies may wane and not be detectable after a certain amount of time. We know that there are very small numbers of people who get reinfected, but it's just a handful reported worldwide, and most people, regardless of their antibody status, don't seem to be getting reinfected, at least not on this kind of time frame that we're talking about. But it's still early. We're still learning. And our hope is that means, that even if you can't measure the antibodies, there's some protection there. And two, that a vaccine will work because, the antibodies that people produce when they're exposed to the viral proteins prevent infection. And so, but I think, that science in particular is still pretty early on. Just not enough time has passed.
I have a clarification and a question. The question, do you see a vaccine being something that people do on an annual basis, or do you see it more like childhood vaccinations where it's a one-time thing?
Good question. I think it's right now they're looking at I think it's one-time thing right now, but I haven't seen anything definitive either way. I think most people think that the virus will be with us for a while, but it is likely that over time and as more people get immunized, that the impact of severe infection will decrease quite a bit. So I think we'll probably not be getting a coronavirus vaccine every year the way we do for flu. There's some differences in the way the viruses work that make me believe that. But it may be true that people over time are susceptible to getting it again. It's just a question of whether it's severe, So maybe I'll get the vaccine and then 5 years from now I'll get COVID, but it's like a cold because I have enough immunity to prevent severe disease. And then that'll boost my immunity, and then it'll be another 5 years before I get it. Wouldn't surprise me if that's what we end up with. What was the other part, Inga?
And the other part is the way I understand it, because we talk about infection rates. Is it my understanding that it's almost exponential?
Yes.
And it's like it's 2, 4, 8, 16.
Exactly.
Right?
That's right.
Boom, and it goes like that, right?
Yeah.
Okay.
Yeah. So that's why when I see our numbers creep up a little bit, and I mean, there's a little bit of a leap here in terms of what's actually going on in the community. But when I see our numbers creep up a little bit, it's not exponential, which tells me that there's some control happening. And that may be because of face coverings or physical distance or something else. But we're not seeing that 1, 2, 4, 8, 16 spread right now that we saw in the early summer. We could get to that place, but I think it's because these things actually, the exponential spread can be mitigated by some of these tools that we've been using.
So keep it up, people.
Keep it up. I was going to say one other thing about the vaccine. It sounds like it'll be 2 shots to start. So you get one, and then a month later you get a booster, which is unfortunate because it means we have to keep track of all that, and everybody needs to get hit twice. But there are other vaccines that are like that. So I think that the leading candidates right now will require that.
And that'd be good for college students. They can do it along with their meningitis and other ones.
Mm-hmm.
There's one question. Is there a recommended time frame to get tested after exposure to the?
Yeah, good question. I finally started to see some data on that. I think it's probably, we're still learning, but if you had to pick a time, I would say 7 days. A week after exposure, that's the greatest chance of catching it and the greatest likelihood that if you're negative, you're unlikely to become infectious. It's still 14 days quarantine time frame, but it does sound like a negative test at 7 or 8 days is pretty reassuring.
So, Dr. Moss, since the data is what is driving the decisions from public health, the accuracy of the information that is reported comes from many different places, right? The sources, hospitals, whatever. So I've heard, there's rumors out there that folks that are dying during COVID from other, illnesses, heart attacks, what have you, may be reported as a COVID death. Is there is this a check and balance? I mean, how do you guys check the accuracy of the information that's coming in?
Yeah, I mean, the most important thing is what the doctor who's taking care of somebody when they die determines, or if, somebody dies at home. Most people die in hospital of COVID, but if somebody dies at home, what the medical examiner determines. And if they say COVID is the cause of death, and typically there's a positive test result as well. We generally accept that. And so it really is the diagnosing physician who is making that determination. And it's not perfect, but most physicians know what they're doing at this point with COVID. COVID can cause pneumonia, but it can also cause, in rare cases, these other, multi-system failure. It can affect other organs. It can cause what we call thrombotic kind of illness, where you get little blood clots. So that can result in damage to lots of organs. And so, it really requires a clinician caring for a patient to say, you tested positive for COVID and you have a clinical disease consistent with COVID that, I think COVID was the cause of death. And that's not a perfect system, but that's the same system we've always had, and we've had it for other things. And in general, I think it's pretty good. Having been somebody who filled out those death certificates myself before, I think it's pretty good. And we have a test usually to go with that, right? And so by and large, that's how the determinations are made. You have to test positive for COVID and have a clinical picture that's consistent. Now, some people are dying from COVID, from heart attacks, but it's not captured as a COVID death because would you have had a heart attack anyways? How much did the illness, some of those are going to be counted as not as COVID deaths, and that's okay. And some are going to be counted as COVID deaths. It's not a perfect system. And without a really in-depth autopsy in a case like that, you're not going to know for sure. For people that, are in a car accident, it's not a COVID death, even if you test positive for COVID. And so a lot of things are not in so much of a gray area. And we actually just had a nice conversation with the state about really focusing our COVID death definition or cases on those ones where it's pretty unambiguous. And so that might mean there's an undercount. And then there's another thing about COVID that we know, in particular when the hospitals are overrun, but more generally, people present to care late, and they are probably dying of other things more frequently than they might have otherwise because of COVID. And that's this excess death due to COVID. And there's some of that data statewide and nationally. We don't have it for Alameda County specifically, although we probably will at some point. More people died in the spring of all kinds of things than just COVID. And that's probably a sort of a secondary effect of the epidemic. Now, we don't count those as COVID deaths in Alameda County, but it is an impact of the pandemic.
Interesting. Okay. Well, we have a few more minutes here, and we don't have any more questions in the Q&A or the chat. If the CEOs have anything else, otherwise, Dr. Moss, if you have any closing comments that you would like to leave us with, hopeful comments.
I appreciate these conversations. I'm sorry the news is not always good, but I think the news could be worse. And I hope that people see it that way. And I cannot express strongly enough my gratitude for the business community across the county, particularly in the Tri-Valley, for putting up with this and for really going through a period of extreme sacrifice. I know people have lost their businesses. And I know people have wanted us to do things differently, but it's been remarkably supportive of the approach that we've taken in Alameda County. And I can't tell you how grateful I am, and how grateful I am to the chambers for allowing me the opportunity to, get up here and speak to you all about it and have to defend our policy decisions, and also to get feedback from you on things that we need to look at. So I really appreciate that, and I'm sure we'll do this again.
Mm-hmm. Mm-hmm. Okay. Well, thank you for that, Dr. Moss. Thank you.
I'm going to try to schedule it for when I know it's going to be good news. Don, if you get an email from me saying I want to come meet, that's a sign that we're seeing positive things in the data.
Okay. But otherwise, it'll probably be about six weeks or so before we see you again. And if you reach out to me sooner than that, then that'll be great. We'll set it up. So 6
weeks from now, that's like December 20th. So
it'll be after
fine with me, but
after Thanksgiving holidays, danger. But yeah, and hopefully we'll have some more good news.
Yeah, I really hope so.
Okay. CEOs, you got anything else? Parting comments for Dr. Moss? Or
Thank you for your insightful discussion. It was really, really very good.
My pleasure.
Thank you for clarifying and everything.
Sure.
So much.
Thank you.
Okay.
Be safe, everyone.
All right. You too.
Bye.
Okay. Bye-bye.